Hello.
Hello, sir.
Very good afternoon to one and all. On behalf of College of Dental Science and Hospital, Amargarh, Bhavnagar, I would like to welcome all the respected dignitaries, our principal, Dr. Pankaj ma'am, our guest speaker, Dr. Ruchi ma'am, all the faculty members, students, and participants to join us for today's International Yoga Day webinar on distress and detox, yoga well-being. It's my pleasure to invite our principal ma'am, Dr. Pankaj ma'am, to address the gathering before we initiate with the program. Please, ma'am.
Am I audible?
Yes, ma'am.
Yeah, thank you so much, Dr. Pranay. At the outset, on behalf of KJ Mehta TB Hospital Trust and College of Dental Science and Hospital Amargarh, I extend a warm welcome to Dr. Ruchi Raval, who has readily agreed to deliver this webinar as of now in short notice. Thank you so much, Dr. Ruchi. And
welcome, ma'am. My pleasure.
And then I thank each and everyone who have actually taken active part in organizing this, and hope all of you would take a maximum advantage of the significance of yoga that will be enlightened by Dr. Ruchi. Thank you so much.
Yes.
Thank you so much, ma'am. Thank you so much, ma'am. I would like to invite Dr. Pankaj to introduce our guest speaker for today's event.
Good afternoon, everyone. A very good afternoon. So, on behalf of the organizing committee, it is my pleasure to welcome you all today, or you all of you today to this webinar. It is an honor to introduce our distinguished speaker, Dr. Ruchi Raval. Welcome, ma'am. Dr. Ruchi is a certified yoga trainer and a certified pre and postnatal yoga therapist with a passion to promoting health and wellness throughout evidence-based yoga practices. She also holds an MDS in periodontology, bringing together her expertise in healthcare and holistic well-being. Her multidisciplinary background enables her to provide valuable insight into the connection between physical health, wellness, and a balanced lifestyle. So we are really looking forward to hearing from you, ma'am. We are delighted to have you here with us today, and I'm looking forward to welcoming you and listening to your webinar. So everyone, please join us in extending a warm virtual welcome to Dr. Ruchi Raval, and I'll hand over the mic to you now, ma'am.
Thank you so much. Thank you, sir. Thank you, ma'am. And thank you, Dr. Pankti, for such a warm welcome. Most important, thank you for this opportunity. We have been associated previously, and it's always a pleasure to connect with our seniors, to connect with our colleagues who are practicing in private practice, who are doing academics, who are doing their best in their life. And with the support of the yoga, we can still do better. So today, I will be basically covering yoga specifically for a dentist, how to de-stress, how to detox, how to take a breaks, and how to work for overall well-being. May I share the screen now?
Yes, ma'am.
Yes, ma'am. Thank you, sir.
Yes, ma'am. I think you can start sharing now.
So, welcome all. This is a presentation I will be covering. We can have a very interactive session. You can stop me in between. You can ask me any doubts. You can add to my something if you want to know. So this is about yoga for dentist, that is de-stress and detox. So starting with something very simple. What is yoga? So most of the time, is my voice clear?
Yes, ma'am.
Okay. So most of the time, we have this feeling that yoga is just an exercise, which I always say that it is something beyond exercise. If your aim is only to get good physically, कि मुझे strengthening करना है, या I want to get a little bit more flexible, in that case, you can go to gym, you can go for a walk, you can go for a trek, you can go for a swimming, whatever it is. But if you are aiming higher, one step higher, that is apart from the physical, I want to become emotionally balanced, become spiritually balanced, and most important, I want to evolve myself above as a good human being, as a spiritual human being, and have a strong calling of life. That is what the yoga is. So most of the people have misunderstood yoga, that it is only for flexibility, it is only for this thing. No, yoga is much more beyond that. Is my slide visible?
Yes, ma'am.
Okay, okay, okay. So yoga, simply explained, I would say yoga is a conscious movement combined with a steady breathing. Most of the time, when you do any other form of the activity, your focus is just on to do that particular form of activity. As far as yoga is there, you synchronize your mind, your body, and your soul. That is, three important things are synchronized. And most important is you synchronize your breathing along with your movement. And that is how the yoga is formed. So instead of just training the muscles or teaching relaxing the light areas, yoga is much beyond that. Okay. It is a kind of a, what do you say, a body reboot by using your own weight, alignment. You can, relax yourself. You can reset your body. So these are the three most important pillars of yoga. Putting it in simple words, I would say asana, pranayam, and meditation. These three are the most important components of yoga. Fourth one we can add from our side is Omkar chanting, which forms a very integral part of the yoga. So asana, which gives you a physical movement, pranayam, breath work, which gives you that synchrony of breathing. And third one is your meditation, mindfulness, that is a mental focus that breaks down your daily combat. Okay, so these are the important components of yoga. Why it works simply? It is effortless. Yoga doesn't require a lot of, high-end instruments. You can do it anywhere. Or that is how the yoga was started to be known to the people. Okay, someone doing it in forest, someone doing it in going into the mountain and doing a yoga. So that is how that message is being passed on, that it is so simple that you can even go to the forest, you can even go to the mountain and still you can do yoga. So it does not require any fancy instrument. It fits perfectly into standard clinical attire, highly customizable for any age range. A few minutes every day is all it takes, just a few minutes. So if anyone has a doubt of, usually this is the doubt which I keep on getting, कि कितना yoga करना है, तो I would say start with 20 minutes. I will not give you a goal of 1 hour. I'll not give you a goal of 45 minutes. Start with 20 minutes. 10 minutes आसन करो, 5 मिनट मेडिटेशन करो, ओमकार करो, थोड़ा ब्रीदिंग करो, 20 minutes शुरू करो. Once you have set up yourself कि हाँ, now I can do, once you have understood it, after that you can increase the time frame to 45 minutes. So ideally, yes, I would suggest 45 minutes, 5 days a week. For the beginner, it is 20 minutes. Okay? So that is the time frame for yoga. Power of consistency. Yes, this is something which I have seen in everyone. योगा डे के दिन सब योगा करेंगे, मजा आ गया, we did a workout and there was a very good flexibility, my muscles are feeling good. 21st June, entire country, 150 crore people are practicing, and 22nd June, the people who practices 22nd June are the real practitioners, I would say. So not only celebrate yoga on 21st June, learn asana, forget it. No, you have to do it every day consistently. As I said, 20 minutes, sometimes as small as 10 minutes of yoga. Okay, massing compounding gains. So this is what they usually say, that 10 मिनट में क्या होगा या 20 मिनट में क्या होगा. So if you do 20 minutes 5 days a week, so you are doing 100 minutes in 1 week, and you are doing 400 minutes of yoga in 1 month. It is better than not doing it at all. Even if you are doing something as small as 10 minutes, you are doing 200 minutes of yoga. That is more than 3 hours of yoga per month ka ho gaya. So 10 minutes, 20 minutes is better than 0 minutes. Doing it with lot of mistakes is better than not doing it at all. So yeah, power of compounding, as we call. Massing compounding gain, short targeted daily breaks are for more effective your muscles. Just 10 minutes will help you to flush out your metabolic waste and it will help you to deliver the oxygen. Okay. So dentist dilemma, understanding why clinical dentistry is so important and what it takes on your body. So this is a very common sight that I see in students, in faculty, sometimes in myself. Okay, so just to reach that difficult areas of oral cavity, posterior areas, ya ho ya आपके upper, this is there. We usually many times we compromise with our ergonomics. So this is a sustained workplace posture for many of the dentists. Okay, that's what they call as a statue trap. Dentists spend hours of thousands of hours holding same, static, asymmetrical position to get a clear sight in the oral cavity. Because we are sitting there with a particular target कि मुझे filling करना है, मुझे impression ठीक से लेना है, मुझे flap surgery का suture पीछे तक जाना है. So our goal at that time is only to have that. And for that, we assume any of the asymmetrical position. What it usually does is very simple. It will lead to a lot of stress on your muscle and it will lead to a compromised posture. What they call as a muscle ischemia, that is holding any posture without moving, starves your muscle of the oxygen and it causes a knot. In short, muscle उस area का थोड़ा compromise हो जाता है and the blood supply to that area will be highly compromised. Second is overcompensation. Your body holds these odd angles and it's a new normal. जैसे हम continuously अगर ऐसे झुक झुक के काम करेंगे तो that abnormal position after some time will become normal. Even after finishing the working on the patient, even when you sit normally, you will sit in a slouch. Even when you will walk with that slouch. So consistently sitting in a wrong posture will create a new normal, which actually is abnormal. Physical reality for dentists. 87% of dentists suffer from MSD. MSD is musculoskeletal disorder, not Mahinder Singh Dhoni. Okay, so MSD are the musculoskeletal disorder cause of early retirement and long-term disability in dentistry. These spinal micro injuries, they stack up slowly, eventually resulting in severe disc pain, nerve compression, and hand tingling. In simple words, long-term, many of the dentists, or we can say most of the dentists, they have muscle spasm and they have any form of a disc prolapse. Spinal cord में issue हो गए, nerve का compression हो रहा है, and that nerve compression, it creates a real pain. Then to correct that, you have to get an MRI done, you have to consult a physio, yoga, orthopedic, all of them collectively will give you that rehab. So it is better to go on a preventive path rather than on the treatment side. Let us start. And I'm sure not only the faculty, even students by this time will be aware of this table. That where do the dentist hurt the most? Most of the time it hurts in cervical, neck area, lower back, shoulder, wrist and hands. Cervical neck area is very common and it is basically triggered because of looking forward and down continuously. As I said, to reach that area, you continuously keep on looking down and because of that, it will lead to constant stiffness, headache, jaw ache. I'm sure everyone knows that the neck pain, it gets triggered to the jaw. So yeah, it will lead to that. Second is your lower back. hunched sitting on the non-supportive tools. Okay, it will basically impact on your work, that with sciatica, sharp nerve pain, and fatigue. Okay, one thing I want to tell here is why neck and lower back are more affected for dentist. As I said, to reach that area, you do a lot of bending and twisting in your neck and lower back. Second is they are unsupported areas. When you sleep flat on your bed, okay, your upper back, your butt area, your legs, your head, all are supported. Your neck area and your lower back area are not supported because of that spinal curve. So even otherwise, because of that unsupported, they give away very easily for any person, not only for the dentist. Okay. Then comes your shoulder, holding arms elevated for scaling, drilling. I would say that your shoulder, ideal position of your shoulder should be, I always say this in my classes, roll your shoulder, lift your chest. Every few minutes, whenever you are able to recall it. जब भी याद आए, do one thing. ऐसे पीछे कर दो shoulder को. Roll your shoulder behind. So what happens is when you roll your shoulder behind, the closing of the shoulder blades can be prevented. One. Second is slouching. जो पूरा दिन हम slouch करके रहते हैं, that can be prevented. Third is when you roll it behind, ये distance improve हो जाएगा between your two shoulder blades. So that distance can be improved, that spine curvature can be maintained, and most important, your shoulder will be relaxed. Shoulder ऐसे रहता है ना कई बार. No, we don't want that. We want our shoulder to be down and to be backward. For that, you have to roll your shoulder pretty much frequently. Okay, so that is there. Then comes your wrist and arm. As we, of course, this is always taught in the dental school, that whenever you are doing scaling, whenever you are doing any hand work, try to apply the force from the shoulder area, from the hand area, elbow area. Don't apply the force from your wrist area or from the fingers area. Don't create that. It will create that lot of stiffness, because the power, when the transmission of the power from the shoulder area is better, more powerful compared to just putting the entire this thing on your wrist. Okay, so wrist and hands, they also are affected. Fine pinch grip and tool vibrations are usually which affects it. Okay, so this is just for your knowledge. Statistics: 70% of the dentists, they have neck problem. Lower back is in 60, shoulder is in 55, and your wrist and hand is 38. Okay, this is more of a theoretical part of it. The gravity of forward tilt, as we said, we are tilting forwards. So we are tilting forwards from our waist area. We are tilting forwards from our shoulder area. We are tilting forwards from our neck area. So for every 15 degrees your head tilts forward, the workload on your neck muscles double. Straight देखोगे तो neck muscles पे इतना stress नहीं आएगा. For every 15 degree tilt किया तो यहाँ का stress double हो जाएगा, और tilt किया और double हो जाएगा. So that is also a message that it is not only for dental work, for your phone also. Entire day everyone is on phone. Imagine how much of neck muscles will be affected because of that. Okay. Again, putting it in a biological world, it is what you call as a upper crossed syndrome. Your chest and your front neck muscles lock in a tight shortened stage. When you look down, तो ये यहाँ से extend होगा. From here, it will be shortened. At the same time, your upper back and deep muscles, they stretch. This will stretch, this will shorten. This leads you into some painful cycle. Okay. So as far as the dentists are there, or any other profession which has a heavy chances of your, what you say, ergonomics, unke liye simple targeted poses I have mentioned here. They are very simple. You can learn it by yourself. You can learn it from someone who is expert in it. A clinical toolkit I have made to target certain areas. Okay. Let us start with something known as a mountain pose, or what we call as a Tadasana. Okay. Okay. So what is there? It will help your body to physically center itself. What it does, it will reverse the slouching and teach you to stand evenly on both the feet. See, this is your Tadasana. You lift your body. When you, along with lifting your body, you also lift your hand like this. Okay. So this will help you to center your feet, and this will help you to reverse the slouching, because when you do this movement, again your shoulder opens up. So that will, your closed hair, that will open up. So it will reverse your slouching. How do you do it? Again, I said, stand tall with feet parallel, roll your shoulder down and back, grow through your crown and take 5 deep breath. Then this one is your Garuda Asana, eagle arm. Actually, Garuda Asana also includes eagle legs, but for a beginner, just start with the arms. Okay. It relaxes your upper back muscles from holding the tools. See, upper back muscles. When you do any kind of a close movement, तो पीछे के muscles stretch होंगे, यहाँ के. See, if I do this movement, the front muscles will stretch. If I do this close movement, the back muscles will stretch. So in that case, when you do this movement, your upper back muscles will stretch. So it will become flexible. It will relax a bit. थोड़ा soft हो जाएगा. It will become supple. Okay. And it unbinds the tight knots which are present between the shoulder. Okay. So this is how you do it. Okay. This can be done with little expertise. Cat cow, one of my favorite and one of the favorite of any person who does it. Cat cow is extremely good for your spine, to improve the spine mobility, and it is very good for your back. Okay, it decompresses पूरे spine का एक curvature वाला movement it creates, and also it relieves your back. Okay, so basically it helps to break the rigidity created by sitting dentistry. It decompresses and lubricates your entire spine. Okay, so this is how it is done. You put your hand below your what do you say, shoulder area. Okay, when you take a breathe out, your chin will touch your chest. So this curve is created, rounding of the back, convexity. When you breathe in, you look up. So concavity is created. Convexity followed by concavity, followed by convexity. So convex, concave, it will create a very nice wave form of a spinal movement, and it will help you to relieve your back. Okay. Again, then this one is a cobra, what we call as a Bhujang Asana. Okay. Very good again to relieve your back, and it is also good for your spine. Okay, it strengthens the weak lower and mid extensors and effortlessly straightens the spine. Okay, again it is very good to reverse your slouching and open a collapsed chest. What you do in this is, this area, when you pull it back, it will reverse your slouching. जो closed shoulder है, that shoulder will start opening. The collapsed chest which is there, that collapsed chest will again start opening. Okay, so again there is this entire technique of how you should be doing it. Okay, your hands should be in line with your shoulders, the shoulder blade. And when you do this asana block by block, dhire karke, you have to lift your lower back, then you lift your upper back. At the end, you open up your shoulder. So entire block by block, your spine will open up. Entire block by block, your back muscles will open up. And at the end, your shoulder will also open up. Excellent asana for any kind of a spine or back problem. Then comes, this is more of a resting pose. That's what I say. It's a child pose, or what we call as a balasana. You can either put your hand on the side or you can put your hand in front. Again, it is used to decompress your lumbar spine and rest. It gently stretches your hips and lower back while triggering the deep nervous reset. In simple words, it is a restful asana. It is very good to create the rest. Just excuse me for a minute. Okay, so this is how it is done. Kneel, sit back on your heels, reset your arms, and this you can do. Setu Bandh Asana, what you call as a bridge pose. Extended, why we do it? Extended sitting weakens your glutes. It tightens your front hip flexors and bridge pose correctors. So it is basically used for your back, for your glutes area and for female. I would add one small point to this. This asana is very good to balance your hormones. Very simple asana, just lie on your back. You can clasp your hands or you can keep your hands open. Gently lift your body. Then comes your tree pose. Tree pose is used to it helps basically, I would say, to create a focus and to create a kind of a stability. Okay, so tree pose Vakrasana helps you maintain solid stability on your feet, because when you are putting your feet, one feet on the floor, you are raising one another feet, you are putting that feet against the other leg, you are creating your entire center within your body. You are creating a balance, you are doing a deep breathing, and continuously you are looking at a one object in front of you. So that looking of one object in front of you, it kind of creates a balance and it helps you to center yourself. Along with it, its other goals are it helps to deep and stabilizing your core. Okay. This is your wrist stretching. Okay. So wrist stretching, something I'll tell you something very simple. This you can do every day. ये करो. Hold, put your hands like this. दूसरे हाथ से इसको ऐसे खींचो. Okay. So when you do this, it will strengthen your wrist. Okay. Dusra, whenever you are free, just do this. Give this micro movements to your fingers. So fingers may, because of the holding of your instrument or because of any other thing, the fatigue which has got accumulated, the stress which has got accumulated, it will get released. So do this finger movements, do this wrist movement every day. Okay. So basically, as I said, it counters the pinching and vibration created from the instrument. Press your hand forward like a stop sign. Pull your fingers like this. Okay. Then comes your conscious relaxation. Okay. Relaxation can be in different forms. So whenever we think about relaxation, हमारे दिमाग में हमेशा ऐसे ही आता है कि let us go for a movie or let us talk to a friend or let us have a coffee. There is something known as a conscious relaxation also. Either you can sit and you can do some deep breathing or you can just do savasana, squats. As far as your office hours, your clinic or your academia is there, it is difficult to go in savasana, of course. So what you can do is you can just do some cool breathing. Just you can do some slow breathing. Conscious, why the word conscious is used? Because you are choosing to relax. रात को जब नींद आती है और गिर जाते हैं सब नींद के मारे, that is a body's relaxation. Here we are choosing, okay, let us take a pause and let us choose a conscious relaxation in form of a breathing, in form of a savasana, or in form of a just sitting on your chair and taking a break. Okay. This was about asana that we covered. Now let us cover the power of breathe. Is everyone with me? Yes. Everyone with me? Does anyone wants to discuss anything? Any doubt anyone has?
Yes, ma'am.
Yes, sir, I can hear you. Shall I continue?
Yes,
Yeah,
ma'am.
yeah, please, Dr. Ruchi.
Yes. Okay. So let us explore the power of breathing. Okay, before that, I would like to give you a simple example. Have you ever noticed कि जब आप कई बार थक जाते हैं या आप what do you say, आप कहीं से भाग के आते हो तो there is something known as a panting, fast breathing होता है. If I ask you to cool down, will you be able to cool down? No, because your mind and your breathing, they go hand in hand. If you are doing a fast breathing, if you are panting, in that case, your mind will also be in a chaos at that time. You will not be able to think very clearly. Think reverse. अगर आपका माइंड एकदम अनस्टेबल है, chaotic है, आप स्ट्रेस में हो, just notice your breathing during that time. It will not be regulated. So that is the reason whenever we are little anxious, our doctor or our someone elder always tells us do some deep breathing. The moment you slow down your breathing, that is the moment you will also be able to slow down your mind. Slow breathing करो, mind भी एकदम slow हो जाएगा. Fast breathing karo, you check it once. Start breathing fast, you will feel that there is a lot of instability in your mind. Okay, so it basically breathing is one system which is help to soothe your nervous system. Okay, quick shallow chest breathing signals stress to the body. It increases the hand tremors. Focusing on slow belly breathing instantly stabilizes your muscles and yourself. Okay. Second is your heart rate. Long exhales stimulates your vagus nerve and it slows down the racing heart. This allows you to maintain cool surgical focus during the high pressure element. Okay. So I will just teach you one simple breathing here. Okay. Something what we call as a box breathing. Okay. Box dekha hai na? Okay. So all the four sides of the box, they are same. Okay. Same. So 4 second, 4 second, 4 second, 4 second. Inhale 4 second, hold 4 second. Exhale 4 second, hold 4 second. So this box breathing is very good to instantly calm you and to calm your nervous system. Okay. So this is how it goes. Very simple. Inhale 4, hold 4. Afterwards, exhale 4. पूरा लंग खाली करने के बाद again hold 4. Okay. Then comes your Shitali Pranayam. Again, basically Shitali Pranayam is the one pranayam that you can learn to cool down yourself, to cool down your body temperature, to cool down your stress and during the summer. Okay. Now coming on to the chair side integration, how to sneak mini yoga stretches and ergonomic habits directly into your clinic habits. Okay. This is some practical toolkit which I have made for all of you to how to take mini breaks. अगर मैं किसी को बोलूं, if I tell anyone कि 10 मिनट का ब्रेक लो, नहीं मेरे पास टाइम नहीं है, I have patients waiting, I have a meeting to attend. But if I ask anyone, take a mini break, 60 second, 1 minute, that 1 minute everyone will have. So in this, let us start with learning something known as a 60-second chair side reset. Okay, so time it right, that is 60 seconds right after the patient leaves you. That 60 seconds you can use to reset your spine. Okay, sitting twist. Sit tall on your stool, hold the backrest and twist your upper body right and left. Okay, chest expansion, that is something like you can just twist your body. Okay, you can just do this. You can roll your shoulder, you can relax, interlace your fingers behind your back, pull your shoulders again, do this, again do this, do this. 60-second reset. Wrist decompression, do this stretching of your wrist. So this is 1 minute you dedicate to yourself after each patient. That is 3 things. You twist your body, you open your shoulder, and you reset your wrist. 60-second reset. Okay. So this is a day in the life of a healthy dentist. Okay. 8 a.m. you can do a mountain pose and a cobra to wake up your core muscles. 12:30 p.m. that is afternoon में chair side shoulder rolls कर सकते हो. Wrist stretching before the lunch you can do. 3 p.m. you can do some box breathing, and evening 6 p.m. you can do a child pose. You can take a screenshot of this. Okay. So morning may you can have that proper asana. During your college or clinical hours, it is not possible for do asana. You do the breathing, you do a chair side stretching, what we call. Okay. Aesthetic ergonomics habit. Okay. Ergonomic habit as in chair side pay to reduce your muscle stress. What all can be done? Okay. So keep your hips above your knee area. Adjust your stool height so your pelvis sits slightly higher than your knees. This tilts your pelvis forward, preserving your natural painless lumbar curve. Okay. Then comes your loops and a neck angle. Rely on a properly aligned dental magnification loops instead of bending your neck. And keep your patient's mouth at a chest level to avoid slouching. Or keep your patient's mouth at the level of elbow. Or you can subjectively evaluate yourself. That is, when you are working on a patient, work like this. And see that your shoulders are down. If you feel that your shoulders have lifted up, that means you are in an incorrect position. And this is not only for your working on your patients, this is for anywhere. The moment you feel that your shoulders have slightly lifted up, that's a wrong posture. Making it stick. Again, as I said, 21st June, entire country practices, 22nd June, who all practices, that they are the real yogis. Okay. So simple strategies to build a long-term clinical career with ease. Okay. Gym lifting versus yoga balance. As I said, it is more of a yoga is more of a holistic and a general approach. Real this thing consistency should be maintained. Complete pain eradication will be there. No significant, there will be a significant daily relief, and this will happen. Okay. Career longevity. This usually happens. As you go ahead, there will be accumulated stress in your body. So people who have crossed their 30, people who have crossed their 35, 40, they should be more vigilant while to take care for their ergonomics. Again, I will go back to that slide. This slide is very, very, very important. क्या करना है? 60-second reset. Twisting, chest expansion, wrist decompression. ये 3 चीजें ही करनी है. It will be finished in 1 minute. Morning में do some exercises. Afternoon में do some stretching. 3 o'clock, again do some box breathing. 6 o'clock, do some child pose. So in short, they are giving you that every 3 to 4 hours, you should decompress your body. Okay. So practice daily and breathe deeply. So that's all for today. This was the main things that I covered. Your spine is very much important. Take care of it. Chair side. It is said that you are as old as your spine. The more mobile your spine is, the more stable your spine is, the more flexible your spine is, that is your age. So your biological age can be calculated based on the age of your spine. So this was for dentist. Now it is open for Q&A. If anyone wants to discuss anything, we can discuss. If anyone wants to talk about anything, we can talk. Is everyone with me? So this is my phone number I am mentioning here. If anyone has any doubts related to the yoga practice, if anyone has any wants to learn anything, if anyone has this will be open.
Thank
Yes,
you, Dr.
sir.
Ruchi. That was a very much informative session.
Thank you, sir.
Any questions from the audience? I think there is no question.
No questions from anyone? Hope the session was useful to all of you. Thank you so much.
Thank you so much, Dr. Ruchi, for being with us for today's webinar. Would like to present the certificate of appreciation for your valuable contribution and guidance on the topic of distress and detox yoga for well-being on the occasion of International Yoga Day 2026. Thank you so much. Please accept the certificate as a token. And
Thank you,
it was
sir. Thank
really
you for this
impressive and
opportunity.
valuable. Hope the participants and the audience will take the lessons for the ergonomics, which is very important factor for the dentistry. Thank you so much, Dr. Ruchi.
Thank you, sir. Wish you all the best, all of you.
As this program is coming to an end, I would like to take the opportunity to present the vote of thanks for today's webinar. First of all, like to thank the Almighty for giving us the opportunity to organize today's webinar. My heartful thanks to the administration and principal Dr. Pankaj Akshay Baike ma'am, the team of dental education unit, all the students and teaching staff, as well as the IT person, Mr. Deval, for helping us out to organize today's event. Thank you so much, Dr. Ruchi, for giving us an enlightening session on the topic of yoga, which is very important for the dentistry. Once again, a big thank you to you. Lastly, would like to thank all the audience and participants for being there and attending the webinar. Thank you so much, everyone. We'll end the session over here. You all will receive the e-certificate within 7 working days. Thank you so much.